Good morning, everybody. Welcome to the Professional Care Workers Week 2024. The event is now in its sixth year, here to celebrate care workers, how professional skilled they are and how important to the society. And I hope all of you will agree, and nobody in the past has disagreed, so we'll see about that. That's why we're here to talk. So I have an amazing team of panelists with me today, who will introduce themselves in a second. We are on the fourth day of Professional Care Workers Week, and this is webinar number 1 of the day. We are recording it. We'll be sharing it on YouTube afterwards and with everybody on the panel as well to make sure that we can be shared even further. And we'll also be sending this to our new Care Minister, Kinnock. So thank you for joining us. Thank you, panelists, for being here. And Richard, can I start with introductions with you, please?
Yes, good morning to everybody. Great to be here and great to support the CWC. My name is Richard Hearn. I'm Divisional Director, Howden Insurance Brokers for the health and social care sector. I've got over 3 decades of experience in the health and social care arena. And I've been specialising in insurance and risk programmes for larger corporate social care clients since the early 1990s.
Lovely, thank you. And Phil?
Morning, everyone. Great to see you, and thank you for having us here. It's a delight. So my name's Phil Hitchcox. I'm from an organisation called Flourish. We are primarily a learning provider specifically for the social care sector. So we support around about 120,000 care workers with their mandatory, their compliance, professional leadership kind of development through a suite of around about 130 courses.
Thank you. And Neil?
Oh, hey, everyone. Yeah, I'm Neil Eastwood, the author of Saving Social Care, which is some people have heard of, and founder and CEO of Care Friends, which is an employee referral app. And for the context of Professional Care Workers Week, it's generated £6.5 million for care workers so far.
Thank you. And Rory?
Good morning. I'm Rory McDonnell. I've got 4 companies, 2 are healthcare. So there's Cavalry Healthcare, which is a supported living and complex care provider. There's Toto, which is a children's residential homes company. And then I have 2 recruitment firms as well. One's called Cavalry Staffing, which is a nursing agency, and one is called Elio, which is a permanent recruitment firm run as a social enterprise, which means we give the majority of our profits back to good causes like the Care Workers Charity. And I should say as well, I'm a registered nurse, and before that, I was a carer for 5 years.
Thank you. And Ashley?
Morning, everyone. So I'm Ash. I'm the Transforming Care Director at Catalyst Care Group. We work with people with a learning disability and autistic people who have been stuck in hospital for long periods of time. We operate as a group, but that's our core focus. And I started as a volunteer carer as well, and went on to do my learning disability nurse training. It's really great to be here.
Thank you. And Sophie?
Hi, I'm Sophie Chester-Glynn. I'm a trustee at the Care Workers Charity, and the day job I am director at Co-Produce Care, and we campaign for the care sector. And also I run care services in the West for people with learning disabilities, mental health, and autistic people.
Thank you. And Dan?
Good morning, everyone. My name is Dan Stedman. I'm the Group HR and Organisational Development Director at Agincare. Agincare offers a broad range of services from learning disability, home care, nursing care, end-of-life care, and residential care. I've been in Agincare for about 8 years, and I've had a people focus probably for the last 2 or 3 years. My life before health and social care was in policing and the military, but with a people focus in both of those things. So I'm really glad to be here, and thank you for the invite.
Thank you. And Vishen?
Good morning, everybody. Thank you to the CWC for asking me to be on this panel. My name is Dr. Vishen Ramkisan. I am a practicing NHS GP. I'm also the CEO of Aged Care Care Homes We own a portfolio of 9 care homes across the southeast of England. Alongside this, I'm also a trustee at Sue Ryder Charity, and I'm delighted to be part of this panel. Thank you.
And Ruth?
Morning, everyone. Ruth French. I'm the director of Stowe Healthcare. We operate 8 nursing and residential homes across East Anglia. And in addition to that, I'm a director of the Outstanding Society, which some of you may be familiar with. And we seek to really try and support all sorts of care providers to be the very best they can be. Thank you.
Thank you. And Claire?
Yep, morning everybody. It's good to see you all and it's good to be working with the Care Workers Charity. I'm Claire Orty, I'm a partner at Brown Jacobson. We're a firm of solicitors that specialises in health and social care law, and I head up the independent health and social care team across the firm. The day job is doing corporate and commercial work, but the previous job was in-house for over 16 years. 7 years were spent with a mental health provider on the board, including being responsible for HR, so over 4,000 staff. And working on the wards. So good to be here.
Thank you. And Deborah?
It's a pleasure to be here this morning. My name is Deborah Rosansky. I'm Director of Research, Policy and Improvement at the Social Care Institute for Excellence. We do a number of things, but I would say our primary focus is raising standards of quality and safety in social care. We do this in several ways, through research, through influencing policymakers, and working with the sector broadly on innovation and improvement.
Thank you. And Andrea?
Good morning. Thank you for inviting me, Carolina. We're very proud supporters of CWC. I'm Andrea Kincaid. I'm Chief Exec of Lifeways Group. We support nearly 4,500 people across England, Scotland and Wales with complex learning disability, autism and mental health needs. And we have a fabulous workforce of nearly 10,000 people. So delighted to join. Thank you.
Thank you. And Charles?
Hello, everyone. Thank you very much for having me here today. I'm one of the co-founders and the chief exec of a company called Florence. And what we do is we help care organizations build a flexible workforce through technology. In a previous life, before starting Florence, I was a doctor.
Thank you. And Amanda?
Morning, everybody. Amanda Scott, CEO for Forest Healthcare, 13 homes across London and the South East. Carer to begin with, qualified as a nurse and spent most of my life in health and adult social care, and happy to fundraise for the Care Workers Charity and support you as a group. So thank you for having me.
Thank you. And John?
Hi, my name's John Handley. I'm the Chief People Officer at HC1 Care Group. We've got around about 20,000 colleagues with homes across Scotland, Wales and England. And I'm also a chair of a very small charity in South London.
Thank you. And Bhavna?
Good morning. Thank you, Carolina, for having me. I'm delighted to be involved in this initiative. I think it's so important. My name's Bhavna King Rao, Managing Director of BKR Care Consultancy. Have been in the sector working for well over 35 years. Started working in a little children's organisation and moved on to become a senior practitioner within CQC for over 23 years, now working as a consultant through both children's side and adult social care. Passionate about care, passionate about supporting and doing things ethically, involved in being advisor to International Care Ethics Observatory. Yes, and thank you, delighted to be involved.
Thank you. And Rebecca?
Hello, I'm Rebecca Garnett-Butcher. I'm MD at Fulcrum Care Consultancy. Again, delighted to be here and to support the Care Workers Charity. It's a cause that's close to our hearts. We provide a range of solutions and support to care providers to help them elevate standards of care and create a positive culture in their organisations. And like a lot of people here, I've been in care since I got my first job. So my first one was working as a support worker in a psychiatric unit for young people. So care's in my blood, and as other people have said, very passionate about what we do.
Thank you. And Richard Apshall.
Thanks, Carolina. It's great to be doing another event with you and the Care Workers charity. I'm Richard Upshaw. I'm the head of product at Sona. So we're a workforce management tech provider trying to enable sort of flexible working and benefit the lives of carers, nurses, and other frontline industries. Prior to joining that, I spent a lifetime in the industry for a small care home provider on the South Coast, working in homes in an array of roles before I started procuring and implementing tech to try and benefit all of the staff.
Lovely, thank you very much. And it's very interesting to see how many of you actually worked as a care worker in the past. Whenever I speak to people who used to work as a care worker, it's no longer their job, they always say it's still my favorite and most rewarding job. So there you go. Right, we're going to start with the questions. And the first one is around the new government. We are a couple of months from the election, a few weeks with the new government in place, obviously with summer recess, a bit less than 2 months. What do you think about decisions that the new elected government has made so far about social care? And what are your hopes from the government in particular for the future? And Ruth, could you start us off, please?
Thanks, Carolina. And, great to see such a wide and knowledgeable panel this morning. I guess my reflections on where we've got to a couple of months in is that I think we probably all still feel very forgotten in social care. Immediate announcements around proposed funding reforms not being taken forward were probably to be expected, but nonetheless, we still have a vacuum that doesn't help any of us move forward. I think what was very interesting coming out of the Lord Darzi report last week was, and although his remit doesn't include social care, a real recognition that actually social care is part of the solution to fix the massive problems around the NHS. And I guess that leads me to thinking, and I think we know at this stage very little about what a national care service might look like under Labour, but should we really be trying to emulate a national health service through a national care service when the National Health Service is underperforming quite so badly? So I guess that's where I would start us off.
Thank you very much, Ruth. Claire?
Yeah, no, I think for me, just to echo what's already been said, I think social care was absent from so many manifestos, and it was absent when Labour came in. We haven't seen it in their plans. They talk a lot about the NHS, and social care is often one line of it. I think it was interesting seeing in Darzi's report that you can't have a functioning NHS without a functioning social care system. The two need to go together. And there is this gap now that they've taken away the proposed reforms as to funding. I think it's urgent that they look at the funding position of it. I talk to clients every week that are getting no fee uplift because the councils, local authorities are saying we haven't got the money to pay anymore for social care, but the care needs don't go away, they don't disappear. That the acuity of some of the service users that providers are looking after is increasing, and a lot of people that used to be dealt with and cared for by the NHS are now being cared for by social care, but social care providers are expected to do it on lower fees, and it's the challenge to provide the level of care. So I think reform is necessary. I think they've got to look at how it's funded. I think they've got to ensure that there is proper funding in place for social care placements. And not just, I think when people talk about social care, they often think about the elderly, but it's across the mental health and learning disability and all areas of social care. And we need that to function and be fully funded in order for the NHS to be able to function and for the whole system not to break down.
Thank you, Claire. Just a reminder to use the hand up option if you want to speak at a particular time. I'm picking people just so we make sure we carry on with the conversation, but very happy for people to just jump in when you feel like it. Neil.
Oh, thanks, Caroline, and I forgot to say congrats on the wedding. I want to take a different angle to this and look specifically at workforce, because I'm obsessed with recruitment and retention of care workers. And I think there's a couple of points I'd like to make to see if there's any reaction from the rest of the panel or those people listening. And one is we know that the government have said they're committing to cutting international recruitment further. We don't know quite what that'll mean for our sector specifically, but talking to colleagues in the NHS, they're really looking to move on to local community-based recruitment, accepting that this ship has somewhat sailed. So I think that's a concern, because we've seen the impact, positive impact that international care workers have made. And then I think there's this new worker rights bill that's coming up. I'd love to get people's feedback on that. My initial feeling is it's very hard in social care to make flexible working work. You can't work from home, for example. But more concerning perhaps for some employers is the unfair dismissal rights moving to, say, day one. If that is the case, then going back to my time as a director in a home care provider of 10,000 staff, I need 5 new suits for the amount of times I'll be in tribunal if that happens. So I think that's really going to push employers to be screening much more carefully and to be looking at the provenance of who they're hiring. I think it could be a fundamental change for us. So yeah, just picking on a couple of workforce points there.
Thank you, Neil. Regarding international recruits, yesterday I put it to the minister to abandon the policy of care workers not being able to bring dependents when they apply for a visa, because it, as far as I know, and I've looked quite deeply, it only applies to the social care workforce. And for us at the Care Workers Charity, it's an incredibly unethical, dehumanizing way to approach anybody who would come here for work, because we're asking people to come and work in England to support our loved ones and families, at the same time saying you have no right to your own relationships and a family. So yes, and the numbers dropped drastically since that policy as well.
Sorry, Carolina, just to chip in on that as well, I'm hearing that providers are finding it hard to get the paperwork just to have a visit from families overseas, a temporary visit to see their loved one who's working here, and that is also, you know, not good at all.
Rory?
There's a lot of positive noise, but it's quite hard. I think, you know, after the Darzi review and talking about social care being a pillar of the solution, you've heard it before, haven't you? So it's all obviously the right thing to say, but I think it's seeing people walk the walk on things like that. And I think from my perspective as a provider, and to speak a little bit to Claire's point as well, unless the funding is there, it's very hard for social care to step up and to take that pressure from the NHS. I think the way that social care is funded is it's a bit of a minefield, and it drives some of the wrong behaviours, especially where it comes to supporting care workers. So we often see companies who pay close to minimum wage or minimum wage find it a lot easier to win bids and tenders, because it's going to cost less, which obviously then leads to worse care outcomes and worse outcomes for carers. Or alternatively, it's those companies that spend, you know, more time on sales and relationship development than they do on staff development and on care that are winning quite a lot of bids. So I think, you know, there's a lot of human stories, and I think when I think about the people that we've been able to support out of the NHS, it kind of gets under my skin a bit when social care, the entire sector's just talked about as something that could help the NHS, rather than us in our own right being, you know, as important, you know, hugely important. And, you know, as a nurse, it's hard for me to separate social care and healthcare. I just sort of see it all as care. One of the other kind of issues of the kinds of unintended consequences maybe of moving people out of hospital into social care is there's a lot of upskilling that needs to be done where people are stuck. And I think 13% of people in hospital are waiting for social care. It's often those people with complex needs like ventilation or spinal care. And what we see in the sector sometimes is companies kind of signing up to say that they can provide that care, when in fact they have no clinical knowledge of those persons' care needs. So what you're kind of producing is this boomerang where people are going in and out of hospital, and that's causing a lot of problems. We were talking to a care provider recently who had their head in the hands because they'd accepted a referral for someone with a trachea, and didn't realise none of their staff had the capability to do airway management, which is putting people at risk. So I think it's really good to keep the conversation going with people who know what they're talking about clinically and in terms of running care providers, to make sure that you don't have these unintended consequences that sound good as a soundbite but don't translate.
Thank you, Rory. And I think that's it. The expertise and the knowledge sits with the people who actually do the work. And we are just on Tuesday, we launched our new project of the advisory board of care workers to the sector and champions care workers. And that is to make sure that in every room there are conversation about social care happens, especially about the workforce care workers are involved. And that applies, to care providers and everybody else. So decisions are made at the top level by people who have potentially never done the job or been anywhere near it. And I have to say the minister was quite keen on that. So that's good to hear. Bhavna.
Hi, thanks. To concur, I think Rory made really good points about taking on people who are very dependent and the staff not being equipped. We deal with, that wasn't the point I was going to make, but I think that's such an important one. As a care consultants, we're expert witnesses in court cases, and we are constantly seeing providers accepting people who are not, they just can't provide for. I think the blur line between healthcare and social care is getting worse. I think people are becoming much more dependent when they're coming into care. And it is the care workers who are picking up those intensive care duties, which is unfair on them. And then they're getting into trouble because they're not able to fulfill that part. And I think that's unfair. But going back, I think the Darcy report, Lord Darcy report was really quite interesting because he's very clear. You can't have one, you shouldn't have one without the other. And I think it's naivety beyond anything that that anyone would think otherwise, because social care picks up the lot of the stress. We saw it during COVID. It was social care, stepped in, did everything. And I think sometimes that's our own fault as well. We keep doing, we keep providing, we keep stepping up, that we're put upon. We're expected to pick it up. And I think with the Care Workers Charity, for example, so on and so forth, having the dialogue with Kinnock, I think that's a really good start. I think the Labour ministers are looking to change. They are frustrated. There isn't enough money, but I think we're going to have to push them along. I think there is the door is slightly more open than it was previously. And I think having the know-how and pushing it, well done, Carolina.
Thank you. And I think on the point of social care picking up more and more healthcare duties, and that's been happening for years. When I was a community care worker, almost daily we would get more responsibility from district nurses, but we weren't being supervised by district nurses in people's homes. We would get the training, but not the regular supervision. But the liability would be on us and the company that employed us, and obviously the want to deliver great care. But there's no way that the system of clinical supervision with care workers in the community, as you have in nursing, for example. So it continues and continues, and then we
Absolutely.
have official delegated health tasks. My worry isn't about care workers' ability to deliver it. Absolutely, with the right training, most care workers can deliver that. My worry is that funding never follows it properly, and the care workers are expected to deliver healthcare duties as minimum wage levels. And you increase the responsibility, you increase the ask, but you don't increase the money being paid in most cases. And in the cases that I've heard of, is being done as a pilot, and then the funding runs out, but the expectation stayed. And COVID pushed us further into that because there was the need. So, Ashley.
I think, again, to echo what everyone else has said, I wanted to go back on this point of internationally recruited carers and nurses, where I've got quite a simplistic view on it. When you look at Maslow's hierarchy of needs and everything that's happening, you know, we're just talking about it now, where more and more responsibility and accountability is being put on care workers. We're asking people to operate at the top of that pyramid whilst they don't have their families with them. They're far away from home. They're not earning. There's a cost of living crisis. They're worried about paying their immediate bills and sending money back. A lot of our support workers come from Zimbabwe, from South Africa. I grew up in Zimbabwe myself, and only came to the UK as a teenager. So I've seen the real struggles that care workers have. So yeah, you know, I think it's basic psychology. I think we're putting so much onto our care workforce, and the responsibility, you know, agreed, you know, there's this glimmer of hope that we're seeing at the moment. Funding is going to need to follow, partnership working is going to need to follow. But I also think there's this renewed expectation, and it's a good thing, but it's also something else for us as leaders and care providers to take on board. I think there's this focus we have to give on leadership and mentoring and coaching and enabling our care workers to progress through their career pathways so that they can feel that they're hitting that self-actualization part of the pyramid. You know, there's a whole host of issues, but I think it all starts from Maslow's, and I'll talk for 7 hours on it. So I will hand over to someone else.
Thank you, Ashley. And at CWC, we always say, you know, if you don't meet care workers' basic needs of having food, dry accommodation, and a warm shower, and feeling safe, and like they can feed their family, you cannot expect them to deliver any kind of care, let alone outstanding care. That is the expectation. So we have to make sure that care workers' well-being is in the right place before we ask them to look after other people's well-being. Thank you, Ashley. And Ruth?
Can I just follow on from Ashley's glimmer of hope? Because I think it is always important for us to look at things that are working well and look at how this can be translated more widely. And this goes back to the partnership working point that Ashley's just made as well. One area where we've seen actually real progress in this in the last few months is a pilot project that we've been doing at Stowe Healthcare with one of our local hospitals and 3 of our care homes. A lot of us are familiar now with the concept of virtual wards. It's a term that we're hearing a lot. This project is different because this is around admission prevention, and this is around setting up a virtual ward so our care home residents don't ever have to go into hospital to deal with a number of the sort of 7 different care pathways. Who does this help? Well, this helps the residents. They love it. This helps their families. It takes a huge amount of pressure off, but it also helps our staff, because I'm afraid to say what we've seen increasingly in recent years, and again, the Darcy report sets it all out, is when our residents come back from hospital, our residents are in a worse condition and the lives of our staff are made immeasurably harder because they are then trying to recondition people who are significantly poorlier than when they ever went into hospital. And I think what's really encouraging about this is we have actually got professionals in the NHS who are reaching out to us in social care, who want to develop new ways of thinking, who want to develop fantastic partnerships. And actually, these are having really good impacts on people's lives. So, you know, let's focus on some of these things that are working well. Don't get me wrong, our NHS colleagues are having to fight tooth and nail for this with their bosses at the hospital to prove this is a concept that is going to work. But I think there is hope out there, and we do have to shout about these positive stories too. Thanks, Carolina.
Thank you, Ruth. And that's very helpful. And like you said, you know, we're talking about the new government coming in. What are the hopes? And I think sharing the good practice and what's going on is definitely a way to do that. And one of the Labour's main missions around health and social care is to go more towards prevention. And that's a great example of actually achieving that. Amanda.
Thank you. I wanted to take myself and my comment back to the initial question. How did I feel as the new Parliament walked into their new offices? I was quite encouraged by Wes Streeting's immediate focus on the regulator and concerns around the regulator. They are a driving force and they do have an impact on how social care stands and is considered. It seems to have all got a bit quiet, but I'm hoping that my hope and aspirations are that there's a lot of work happening behind the scenes, because I think our regulatory body is not serving us, it's not serving the public, and I think that's been openly acknowledged. And we have fragmented regulatory oversight. So we have local authorities with views, then we have the CQC with their own views, local councils making local decisions against national policy that lots of organisations need to roll out, appealing for funding. There is no money unless you appeal. These sorts of decisions are crushing. And from the pieces that very relevant points that I've listened to already, what I constantly find us needing to do in social care is try and find solutions to broken systems. So I think, all of the lobbying and, events such as today are our opportunity to be loud and vocal and determined in insisting on change, and that change is necessary. So thank you.
Thank you very much, Amanda. And yeah, change is definitely necessary. And John.
Thanks, Carolina. Just acknowledging a few things that people have said. Rory, the sort of race to the bottom. I mean, goodness me, that's an awful place to be, isn't it? The cheapest you can possibly find. Ashley, I love your focus on the human psychology element, basic decency and understanding human beings who provide care. I think, Ruth, your point about NHS and effectively innovating is really important. And then Amanda, your point about broken systems. The systems are broken. So just got 3 points I think I wanted just to build, coming back to the question. We mentioned funding, and I think funding I'm thinking of in three ways. One is for pay and benefits. We've got to get that right, because clearly there's indicators that we might be heading in a positive direction. We'll see. But also in learning and leadership. And then the third one was in technology, because I think technology is potentially one of the ways we can be really smart, really innovative, and try different things. That leads to my second point, which is about partnership, which I think a couple of colleagues have referenced already, is where can we find ways of doing things very differently? And I think we see a similar pattern. The NHS colleagues are in a really difficult place. And one of the solutions is the work that we as a sector can do and we as organisations can do. How do we bridge that gap? Partly through relationships, partly through technology, partly through sheer will, is probably what we're leaning on quite a lot. And then I guess the other thing for me is about sort of stability. If we could have stability, by which I sort of mean multi-year decisions, multi-year funding levels, because without it, we end up making short-term, maybe good tactical decisions, but we never quite get out of the cycle that we're in. So my early sort of feeling is there's opportunity. The sense of direction sounds like it's positive, but like all other colleagues on the panel have said, you don't quite know until the funding comes through or doesn't come through. And then one final thing I'd say, let's assume funding does come through. We have an obligation ourselves as well, everyone who's on this call and our partners, to find a way of changing what we do. Because you can't do it ourselves, and government can't do it themselves either. It has to be a combination. So how do we find ways of really innovating and changing some of the things? I'll come back. I think it was Neil who said something before about it's not easy to flex patterns if you're working at home. I think it's not easy for sure. Can it be done? I think it can, and I think Richard, I'm sure you'll have a point of view on it in terms of the technology we can use. I think we can innovate. We're doing some very interesting things at the moment around how you can schedule more flexible shift patterns and more flexible contracts, which actually benefit the organisation, in our case HC1, and our colleagues. But it's different, and it's not straightforward, and it's not instructive. You have to partner internally too. But hopeful I guess is the way I'd probably think about it. But we've been here before. Let's hope we don't repeat some of the former mistakes that we've made.
Thank you, John. There is so much innovation in social care, and I hope that some of it can be presented to the government for either replication in a different area or just scaling, you know, to a much bigger project, because there are so many amazing examples of how people who are trying to do or succeeding to do that it's definitely worth making sure that we put it in front of people who may be able to make it happen at a larger scale. Although at times the scale is the thing that breaks it. I think we do have to acknowledge that not every innovation intervention is possible to be done at a national scale. And you have to have a certain combination of people and will in place to make some things work. But thank you. Deborah.
Thank you. Getting back to the original question about our view around government policy, we were originally disappointed because we felt that social care was overlooked, that it had been sort of kicked into the long grass. There seemed to be an early promise of some kind of royal commission on the future of social care, which is another review on top of 30 years of reviews on the future of social care. So we've been thinking about, well, what can we do in the meantime? We're part of a coalition from the sector called Time to Act Board. It's working with directors of adult social services, for example, and local government officials to try to execute change. We need to involve providers more. We need to grab hold of the kind of innovation and ideas that you have about how we can deliver improvement in social care. The other thing that struck me last week with the Darzi report is that even though social care seems to be kicked into the long grass, there are enormous opportunities to show leadership for the sector and to really improve things for people who depend on social care every day. And there are 3 shifts that the government is looking to do within the health service, to go from an illness service to a prevention service. So as Ruth was saying, virtual wards are part of that. I would say also there is certainly innovation in supporting choice and independence with other new care models that could support prevention. Moving from hospital to community services, not sure if funding would follow that, but we hope it does. But again, social care is very much a part of local communities. There's lots of care providers as well as the voluntary sector supporting people to live independent lives. And if we think broadly, there's a real potential there to generate some, as you say, some scale and spread of good ideas. And the third sort of strand of work is moving from analog to digital. As with all of the people on this call here, there's enormous potential to expand the work that we do digitally to support care workers. It could be around upskilling them. We're working on a project around that to build and reinforce skills on the job. Very happy to talk to people about that. We're trying to translate best practice into kind of core skills, things that provide reassurance and build confidence and support job satisfaction. Those are the kinds of things that we can do as a sector without having to wait for government direction. I think the funding issue is going to continue to be a real challenge. And the last thing I'll say is that what we're doing at Sky is looking at how government proposals will affect people who draw on care and support. We're trying to see, for example, if the employment rights legislation will have a positive or negative effect on people with personal assistance, for example. The main objective for us is to make sure that people who draw on care and support are not in some way disadvantaged by these new ideas that are being put forward in legislation. I'll leave it at that. Thanks.
Thanks a lot, Deborah. And Andrea?
Thanks, Carolina. I think there's so many points made. I've been sat patiently, and every time someone says something new, I think, oh, I've got something to say about that as well. So just going back to the original question about the new government, I think the problem is that we were in a void for a long time pre-election. Nothing had moved in social care even before the government changed. We've now really, quite frankly, from my perspective, I think we're still in a situation where we don't actually know the direction of travel. And that then is coupled with the issues that the CQC are experiencing. So as a provider, a large provider, that makes it difficult for us to plan forward. You know, we have a responsibility to an awful lot of people. We need to know what the direction of travel is. We need to know what good and outstanding looks like. We need to know what the funding will look like. We need to know what the challenges are, because we're all pragmatic, we're all realistic, we know they exist. And then we can go forward, and we cannot afford to wait. And I think that, you know, when I listen to the pathways and synergies between the NHS and social care, I think there's been some really great points made about, do we really want one system when the NHS isn't working? I think is 100% correct. I think when we look at the complexities of the people we support, I don't now, but I have run vent and track services, and I would be terrified to think that people were either commissioning or accepting that work without the right level of skill within their organisation. So one of the things I feel very passionate about is, whilst there are synergies, whilst there is great collaboration, we need to accept and recognise the differences. We don't treat people who have an ABI in the same way as someone with a learning disability or mental health support needs. So why are we all trying to squeeze into one profile? Actually, we need to work together. We need to have clear pathways. We have people who can support people with incredibly complex needs. And I'm very proud of that, because why would a working age adult want to be stuck in an inappropriate placement in a hospital setting rather than be cared for at home? We all know, though, we lack parity between our care workers and those in the NHS. And until that professionalisation of the role and the acceptance of the skill and the recognition and reward and the equal parity is maintained, people will always see social care as a bit of a third wheel, quite frankly. And I think that we need help in the sector to recognise the incredible work that care workers do and what real impact that has on keeping people out of hospital, how it impacts their lives positively by having more control over their care. And it still astounds me that whilst we know in pretty much all areas, demand continues to outstrip supply, and that will increase, and we have people stuck in inappropriate settings when we have vacancies and we can take people. We have recently opened a service which has been nominated for many awards, that was a public-private partnership, which has been extremely successful. And one of the people living in that service had been in a hospital setting for 17 years. You know, it's scandalous that that's still happening. And I'll just say one more thing, because like others here, I could go on forever. But until care providers in the social care sector are joining the table to give our professional view on how things need to work, how things need to be funded, let's face it, there's no incentive for a local authority to pick up funding to move someone out of hospital. We know what we need to do, we know what we can do, but we've got the service that we can provide. We need to free up the system. So I really welcome anything that recognises the professionalism of our care workers and the incredible work they do. They should be backed up with great training, great support, and great recognition.
Thank you very much, Andrea. Couldn't agree more on the recognition and reward and professionalization, or an already professional workforce that just doesn't get recognized for
absolutely
skilled and professional they are. Thank you. Charles.
Thanks, Carolina. So on the government reform piece, I think I'm cautiously optimistic. So a lot of the last government, the focus on social care reform was all about payers, was all about how much you as a recipient of social care would have to pay when you got to the point of needing social care. So it was very non-focused on the sector. What I think this government's done that's really important, and I think they're talking about a lot, is this big focus on workforce. So a new pay, a fair deal for social care workers. We're yet to see exactly what that looks like, but I think the principle that we should be aiming for things like pay parity in the workforce with the NHS, or national pay structures, or a sector-specific minimum wage, or better collective bargaining, I think are important, because we all want to make sure that we have good retention and rewards in the sector. The only problem is that whole conversation about the fair pay deal for care workers has absolutely zero mention in it about the third piece of the puzzle, which is the providers, right? And how much they're getting paid to provide their service. And so if you look at the graphs of how things like the national living wage have increased over the last 5 years, and the amount of providers getting paid to deliver their service in comparison, there's an increasing delta within that. So we know that providers are more and more increasingly cash strapped over the last few years because of these kind of interventions. So yes, I'm cautiously optimistic about the recent focus to the workforce. I think that's an extremely positive move, but I think if it's not accompanied by a really robust conversation about local authority funding of care providers, then it will A, be unworkable, and B, we'll see a lot of providers become unsustainable and ultimately go bust.
Thank you, Charles. Very helpful. Vishen?
Thank you, Carolina. I just want to circle back to the point on, what is effectively bias towards our industry, where, overseas care workers working in social care are unable to host and bring their families. This poses a real threat to us. A number of providers, operators across the country have worked really hard to create opportunities, recruit staff from overseas, train them, help them settle in the UK, and be part and develop, our cultural strengths as well. The NHS are now picking from our workforce, and they're doing that at stealth. This is a significant threat going into this winter and 2025. We're unable to compete because in a number of areas, hospital trusts are able to offer better pay, the ability to recruit there and bring their families, but also offer hospital accommodation at lower than market rent. Those of us in social care, we operate a portfolio of homes in the southeast of England. We're just unable to compete. And when I look at it from a human perspective, I think of these staff on a one-to-one basis and think, yeah, you're making the right decision. You may as well go to work and transfer over to employer, because I came to England as an immigrant 20 years ago. I was on my own. I started off, living in shared accommodation before being able to practice as a doctor and then, start my career. I would not have survived, nor would I have been as successful in the work that I do had I not had the support of my family. And I would have considered going to the United States, Canada, or Australia if Britain had closed doors. I think this is a very important fact. And we should not, in any conversation with leaders, both from the government, but other organizations that work in care, this topic should not move off the top 3 agenda items, because this is disparity to our sector and it is bias as well. I have a number of other things I can talk about, but I'll get colleagues a chance to go ahead of me.
Thank you very much. And I absolutely agree with you. It is a bias against one workforce only. Yes, like I said at the beginning, we consider it being incredibly unethical. Sophie.
Some incredible comments by Vishen there, and I think definitely applaud him on bringing those to the fore. I think it was Maya Angelou that said, if someone shows you who they are, you should believe them. And at the start, I definitely did feel, and I think everyone else has said, there wasn't a positioning of social care at the forefront. And I think that's really the way that the government probably wishes to go forward. in the next 4 years is just hegemonizing the NHS as it always has done. Government over government, you know, lots of previous governments have done the same. And I think that's why it's so important to have an overall vision. And that's what I'm lacking as a social care leader, is having from my government an overall vision for social care that, you know, may see it by itself, may see it with the NHS. I know that there's a National Care Service that's being touted. We don't know what that looked like. You know, it seems to be a government of sound bites, and that doesn't help anyone. It doesn't help anyone plan. It doesn't help anyone know where they're going. It doesn't help the sector. And I think that's what I'd like, is some real leadership to understand where we're going. One thing we do know for sure is that the government is focused on the economy and bringing costs down and raising taxes in certain ways, but whether it's raising them in the right way and actually making the hard decisions it's saying it's making is out for debate as far as I'm concerned. I think, you know, there's people with much broader shoulders who could take tax rises that could support our sector more, that they haven't made decisions on. And there's a great book, and I can't remember the author, but she had a title is Who Cooked Adam Smith's Dinner? Adam Smith, the economist. And of course, his mum did most of the time until he was, you know, basically in his 40s. Most of his life, cooked his dinner, washed his clothes, looked after him. And I feel like that is very significant in the way that we see social care. It actually props up the rest of the economy. And that's why it should be hegemonized, not the NHS. And we've actually been doing some research at Co-Produce Care, and we've looked at certain pilots, which other people have talked about. And what we found are things like Restore 2, where social care is taught how to speak the language, if you like, of the health service. So if you've got a person who becomes ill or you think is poorly, rather than ringing up the ambulance and say, you know, we think we've got someone who's poorly, you actually able to do some observations and give a score. And then the pharmacist, ambulance service can say, well, we need to come to this person because the score is a certain high level, or actually this person just needs some more obs. So that actually, those pilots which fund social care in terms of training, in terms of kit, a Wizan kit, some people may be familiar with, is another one we've looked at. There's some real benefits, but who really sees the economic benefits is the NHS, because it means that that person doesn't have to go into hospital if the right obs are being made in the care home. So then, therefore, does it not make more sense to use NHS funding for social care because of the economic benefit that is seen? So I think really before they do anything, they need to look at the research. They need to maybe consult with the sector to find out what works, because I don't know about anybody else, but I am all teched out. I mean, how many people does it take to change a light bulb? Everyone seems to have something to do that can help you with scheduling or help you with meds, and it's just too much. So to look at systems that will just work more across the board and find out where the glitches are, because we also found that where care homes are taking up tech, then they have difficulty with GPs or pharmacists also buying into that tech. So the system doesn't work and it's patchy. So more research, more support for the sector, and absolutely engage with things like the Care Workers Charity is doing. I think the advisory board is fantastic. And I think, Caroline, if I'm right, applications for that close in October. So if there are care workers who want to have their voices heard in high places with decision makers, then please do apply, because it's a fantastic initiative that the Care Workers Charity has started.
Thank you very much, Sophie. Lots of interesting points. I'll pick up on the tech one, as Richard is just about to speak after you as well. And one of the missions for health and social care is going from analog to digital in the Labour government. So I think there's going to be it's definitely going to be a very strong push on tech. And it's very interesting what you said about tech isn't always the solution to everything, because so many other things are not necessarily working. Now over to Richard to tell us how tech can actually help, I'm sure.
It's a tough one to follow. Hey, as a provider saying that tech can't fix everything, and I think it was John he spoke a while ago that got me excited to come to the stage and say a few bits. But there's been so many other points I just kind of want to pull together and then try and tie it back to the original question. So I think the theme that I've been picking up on when you think about the new government in place and social care reform and what are our hopes, I think like John, Deborah and Andrea have all said pretty much the same thing, which we can't afford to wait. And again, Sophie, I think you alluded to it, they need to do research, they need to dig into things like these reforms, these changes, they're not going to come tomorrow, they're likely not to come next week, right? Like we're talking about time. But then the other thing that I've heard from a lot of people is, but we can help ourselves. Yes, Sophie's point, you need that vision. Like there is stuff that needs to come from the government, the reform needs to come. But in the meantime, what is it that providers can do, and how can we approach things? And John was alluding to sort of flexibility and scaling, and this is one of the things that tech can help with, right? So scheduling, which I know Sophie called out on, but is so core to everything in health and safety. You need the right people in the right place at the right time, providing the right care, and they need to be qualified with the right things. And at the moment, all of that logic sits in a manager's head. You can be the best manager in the world, and if you are, you may run a really good home, but that doesn't scale. One brilliant mind can't run everything, and this is where tech can start to help. And to John's point around flexibility for the workers and therefore better care for the residents, 6 and 12-hour shifts are really easy, right? People can manage that. I need roughly this number of people. It's manageable chunks for a human brain. AI and tech from that point genuinely can, so that's just computable. You can give it more inputs about when is the care needed, what does type of support do these people need, and suddenly you can start to look, actually, I can have a 4-hour shift here so that person can do the school run with their kids, and I can have this shift here so that person can live their life in that way. And you start to be able to schedule, still delivering the exact care that you need, but giving that flexibility to enable the workforce to live their life. So again, that doesn't deal with the issues of pay and things like that, but it can still improve the quality of life for those care workers substantially when they're needed at a time and place where they can have the biggest impact. I think somebody has 2 more points, I promise, and I'll cede the floor, talking around upskilling and how we can get, and again, this I do think is where tech can start to come into, again, get people in the right place at the right time, but also give them the right information. Back when I worked for a provider, I don't want to show my age, it was going back sort of 15 years now, and day one, it was sit down and read literally like 30 policies. Tick that you read the policies, now you can go off and be on the floor. And it's like, how many of those staff, again, best care staff in the world, how many of them are going to remember everything in 30 policies? Whereas you put tech in someone's pocket and teach it the policies. And again, AI, these large language models, what do I do when this happens? How do I approach this situation? You can grab that policy, you can surface it. So you don't need to remember, you can take this cognitive load off and enable people to be with the residents, right? Because that's the two things I always try and index for, is happy care workers and therefore happy residents, and tech can take away some of that burden. And then lastly, and I promise I'll be quiet, recognition and reward is something that I just think is so important. And again, this can come from the top and this comes from pay and all of those things. But having done a large piece of research, I think it was sort of 2 years ago now, fundamentally a thank you goes a tremendously long way. And again, that can be a thank you from the manager. And we often saw things where night staff and managers don't often meet on and things like this. And actually, again, that's where tech can enable, hey, I came in and this resident said that you were great last night, so I'm just going to send you a little digital thank you, just a little something, or recognize you in some way. And again, this is where tech can break those barriers, because you can't be everywhere as a manager, and you can't have a team that always is. But when you hear about these things, if you can pass that thank you on, that little endorphin hit can be all a carer needs to get, to rally them and boost them again. It's not the same as food and shelter, I appreciate, but inside, mentally, it can have such an impact. So I do think there are some key areas here where tech can help in the meantime, whilst we are waiting for this sort of bigger reform.
Thank you very much, Richard. On the point of AI, especially generative AI in social care, we've been involved with digital social care and Oxford University around guidance for AI in social care, because there isn't one really in place. So there is a part that care workers, we organized a roundtable with care workers where they're actually actively involved in writing guidance for the workforce. There's one being drawn up by the providers, by people who draw on care, for all of it to come together and actually give people idea of what is safe, what are the right things to do, what are the wrong things to do. And most of all, always ask questions and let's learn from each other, because there are opportunities there, but there are also a lot of worries, I think, how AI in particular is being used. Dan, I'll let you go. Then everybody else after Dan, you have spoken already. So if you're okay, I'll move us to the next question after Dan speaks. So Dan.
Thank you, Carolina. Yeah, I just wanted a couple of points, really. Lots of excellent points already made. One of the things around, we've got to have the dialogue with government that is on their same wavelength. So for international recruitment, for example, it has brought an immense amount of stabilisation into our own company. That people have brought skills that many of our workforce didn't have. They work longer hours, and I don't mean exploited hours. They work 40 hours versus an average of 22 hours across our local workforce. They build up longer term relationships with people that we look after as a result. And with the churn in the industry as it is, they're a stabilised face in that workplace. It's brought an immense, many more benefits than we thought we would see. And going back to the family issue, we've brought over 450 people now. About 400 of them have brought their families over. And many of those family members are also now working in our industry, but they're all contributing towards the local economy. They're either working with us or working elsewhere. The work ethic is incredible. So there's a benefit financially to the local economy. And I think we ought not to shy away from that as well, talking about that. The other point I wanted to make was the problem we have as a sector is engaging with government in a single voice. And at times, there is that discomfort with the government about engaging with companies that are there who are making money, who are not public sector. And I think we should actually not be fearful to be proud to talk about the fact that our sector really innovates. We talked about technology here, we talked about different ways of working. We have had to cope with uncertainty around funding, with issues around postcode lottery about funding. We've had to innovate about how we deliver care. And yet we excel in many, many places. And we do that with an entrepreneurial spirit and a dedication to actually do it with dignity and bring good quality of care. And someone also pointed out earlier, the NHS is not always a very good example of any of those things. And I think we should not be shy. Now is the moment not to be shy, to actually try and be a single voice if we can. And that's a bigger debate about should we have any single representative body, really. But we should not be shying away from the fact that there is so much variation and entrepreneurial innovation within our sector that I think is what makes us sustainable. And I think that voice needs to be heard with this new government.
Thank you very much, Dan. That's very helpful. I'd like to move on to the next question now, and I'd appreciate snappy bullet point answers here, so then we can go to the next one. And I'll start with you, Richard, from Howden, in terms of your 3 priorities for social care. If you had 30 seconds with the Secretary of Health for Health and Social Care or the Care Minister, what would be the 3 things that you say to them that are the most important?
Thank you, Carolina. I think we're in a strange position here because obviously we're providing services into the sector. We're not the sector in terms of the frontline care and the challenges that come with the businesses and the the services that have to deal with that. So I think we see reforms and priorities coming down the track, and we try and articulate what that means from a risk and an insurance perspective and offer a fit for purpose offering. Saying that, I think probably the 3 things I'm going to say everyone's thinking anyway, but adequacy of provision. Do we have enough capacity and provision for the demand there is? And I think from the conversation we've already had, we don't. There's an acute NHS bed blockage issue ongoing. A lot of people could be released, but there's nowhere to release them to. And we've talked about funding, what that means between NHS and social care. There's a lot more around that. I think workforce, the stories I always hear from an insurance perspective, talking to customers and clients, is that particularly nurse provision is very, very hard to come across and find and keep. And we've already touched on it in this call. There's the wider issue of staff being brought in from abroad and that seems to be very, very difficult to do and has all sorts of problems linked to it. I think also, I'm not saying it hasn't been thought about, not actually discussed very much today, but it's, what are the progression opportunities in the sector? Quite often it's linear. You start as a care worker, you move to a line manager, and eventually become a care manager. And if that's what you want to aspire to, that's fantastic. But what are the options to assist someone to start their own care home, perhaps, or move into a different part of care, maybe a physio, if that's their aspiration for progression? And I'm not saying that would change the churn rate, but it might have an impact on people staying in the sector a bit longer. And not a new one by any means, but everyone's talked about it, funding. There's no long-term solution yet. Lots of politicians talk about what they might do or could do, but no one actually ever seems to do what they say they're going to do. And I think that causes all sorts of concerns, as has already been articulated on this call, in terms of how you plan for the future and how you resource for the future. I won't go on, but there's integration with NHS. How's that going to be managed? Regulation and quality standards, clearly. An area that I'm heavily involved in on the healthcare side, because 20% of my time is looking after healthcare providers, and we've talked about it, is technology and innovation. What's the government going to do around that? And this absolutely is not a sales pitch, but when you look at tech and how it interacts on the healthcare side, there's a lot more, I think, interaction going on there with AI, with scanning, with telemedicine. But there's massive risks that come with that I just don't think people understand from a broker perspective or from a provider perspective. So yeah, those are the sort of areas I would certainly touch on, but I kind of feel a bit it's not my question to answer, because I'm providing a service into the sector as opposed to at the front line trying to deliver the service that the people so desperately need.
There is a good reason why we always invite a variety of voices, which includes providers, suppliers, and other organizations, is to have the wide range of views, Richard. So that, I think that was very, very helpful. On the skills progression, there was a very big piece of work being done last year on the pathway. And we fought very hard from CWC point of view, first of all, for pay differentiation between different levels, because it's just non-existent in many places, especially in general funding. And secondly, for care workers to have a pathway into a specialism. So if you want to progress, you don't necessarily have to be a manager or a deputy, but you can actually develop your career like nurses into a specialism where you can continue being in face-to-face care, but your expertise and time served are being recognized both in the title and in the pay that you receive. I'm yet to see where the new government is going to go with that, whether they're going to pick it up or whether that's going to be dropped. But that was a very important piece of work last year that we're involved in. Phil, I was just going to go to you, and I lost you off my screen because you moved up. Because
that's all right, no problem. I was just responding to your point there, Carolina, around the kind of workforce development and training and some of the skill shortages that we've got. And I think to that point, fundamentally, it's how do we continue to kind of raise the flag, raise the profile of social care being a career of choice. We know that we have a recruitment crisis, we've got a retention crisis, we've got some significant skill shortages at all different levels. And I suppose that's not only today, it's about future-proofing the industry, which will obviously continue to grow as the pressure continues to go into social care. So how do we attract the kind of future talent into the industry? So how can the funding have a better connection with the education system, whether that's secondary schools, whether that's further education, universities, to be banging the drum and celebrating that social care is a career of choice. It is a rewarding, enjoyable, kind of industry to work in. And I think there's some significant gaps in terms of those connections. Social care isn't necessarily mainstream in terms of careers and guidance in schools, and I think it should be, because this is the future lifeblood of the sector. So I think certainly that's important. And I think the points that have been threaded through all of this is around digital skills. It's certainly something we find we're a service provider as well as a digital learning provider. We still know from a learning perspective, I think something like 40-45% of the social care sector is still very much paper-based when it comes to learning. And actually we're seeing huge efficiencies that are being created, massive impact in terms of compliance by using digital learning, but it comes down to removing some of those barriers to entry. What is digital? We quite often find with managers or leaders, still people are trying to interpret what does digital mean? What does it actually mean to the end user? So a lot of this is about not just kind of giving access to technology, but it's teaching what is technology, and how can they best use it to their advantage within any particular kind of setting. And often that is the managers themselves engaging and embracing. So I think there's quite a lot for me that, we've circled around quite a lot here, but I think, it's raising the profile of the sector and really truly creating some good sustainable careers in the industry going forward.
Thank you very much. And Rebecca, is there anything you'd like to add on the priorities?
Yeah, absolutely. I think for me, the regulator is obviously a really key one here. And I'm sure Bhavna would agree we're on site an awful lot with providers, different types of providers, so sort of elder care, supported living, domiciliary care. And what we are seeing is a regulator that isn't fit for purpose. And sort of interestingly, a regulator that is driven by enforcement. Enforcement's actually a KPI at the CQC, and inspectors seem to have not earned their stripes unless they've got some enforcement action under their belt. And it's driving some poor behaviours. And we're seeing providers suffer, and also their care staff suffer as well. So I think it's, for me, I hope that the DAFT review really comes up with something good. I think it's going to be a big challenge because, at the end of the day, the people and the culture in the CQC have got to a point where it needs to change, and that was a big ship to turn around. But yeah, I think I kind of eagerly await that, really. And then just another point that I would sort of make around workforce is around culture as well, because I think funding is key, and obviously I think we all need to push for that funding for our services. But providers are between a rock and a hard place, in terms of what they're able to pay, because if providers are being paid X amount, there are times when providers, we would all love to pay care staff more money, but actually the facts are that the numbers don't stack up. And I think that one of the things that we see, which is quite interesting, is that we see some providers who are getting absolutely fantastic results in terms of retention, in terms of engagement, and that those things are around culture. So that's another thing I'm really passionate about, and I think that it's something we see done badly, and we also see it done really well. And that actually, whilst we might not be able to get an immediate result in terms of funding to pay people what they deserve to be paid, there are lots of things that can be done to look after our care workers, and provide them with support, training, understanding, and care, to help them provide the care, a high level of care for the people we look after.
Thank you very much. Bhavna, I see your hand up. Am I expecting you to speak about the regulator? And if not, could you speak about the regulator?
Can I talk about a couple of bits? So for me, the regulator is absolutely critical. I've recently been in Scotland. We've done some work in Wales as well. So I'm involved in the changes and the reviews within the regulator. So to having a change in regulator, I've been calling out vote for no confidence with CQC for the last 10 years. So I think it's a good time. I think this is an impetus that was needed. If we can get it right, it'd be brilliant. I think, God, if it goes well, we should be in a stronger position. It's a win-win. For me, the three main priorities would be integration of health and social care. Absolutely. We just need to get that right. We need to get it spot on. The government can't do it alone because they don't have the experience that we have. So they need to tap into people like yourself. Again, when I said about your connection with Kinnup, brilliant. We need more of that. We need to bring it together. So that'd be the first priority. Regulation, we said. The last bit, I think there's IT and AI so important. It can really work. It frees up the people to do the care rather than sitting there writing notes, being silly about it. I think those are three things absolutely would help support with the management, the structure, the leadership, all of those comes together. But I know we're pushed for time, but I think that for me would be the way to bring it together. I have been involved in discussion, with what's going on with Ofsted and CQC. Ofsted have actually now finally been pushed into accepting that they should do things differently following the dreadful tragedy. And I think CQC I think Kate Roney came and apologised after she was made to apologise, rather than apologising before the whole issues, you know, and where the CEO disappeared once everything was about to come out. Shame, but if it changes, fine. Let's accept the apology for what it is if it makes the difference.
Thank you very much, Bhavna. Vishen?
Thank you, Carolina. You know, if you asked about a priority, the one thing I'd like to raise, which I don't think has been mentioned, you know, the Darzi report mentions analog to digital. It mentions community versus acute. I come from a background leading national programs of IT at NHS Digital for the last 10 years. Across the entire health service, there is a connectivity program known as the Health and Social Care Network. It provides IT, secure, high-speed connectivity to every hospital, every GP surgery, every pharmacy, every optician. Social care is not mentioned within the Health and Social Care Network. There's no connectivity to our care home, be it domiciliary or care homes themselves. Rushing down a digital path is great. We do need the infrastructure to support this. If we are truly going to be connected to secondary care and primary care to allow us to look after residents, to prevent admissions or to facilitate early discharge from hospital, then we need secure infrastructure to do this. At this moment, all of the innovation is really great. However, there is also a massive cybersecurity and a GDPR risk using public infrastructure, which is what all of us do because we're not part of the secure network. So asking us to digitize is fantastic. We do need the infrastructure and the tools to deliver that safely. I often, you know, I'm very keen on innovation. At Aged Care, we're building our own platform as well. However, I'm also very wary of a GDPR breach, cybersecurity, and the ICO coming down on us for anything that, you know, could put our entire business at risk. Thank you.
Thank you, Vishen. That's a very important point. Like I mentioned with AI, that was one of the points that care workers themselves raised as well. GDPR issues, liability issues, who's actually in the end responsible. And it is incredibly frustrating that when there's a conversation about an infrastructure, it's health to health to health to health, and social care isn't included. And I think you would have hoped that COVID has taught a lesson of those systems need to be better connected. But it seems that it didn't necessarily. So thank you. Sophie.
Sorry, before I end, the point is we are included only in the name of the program because it is the Health and Social Care Network, but in reality, we're not included in the connectivity, and that does need to be rectified. Sorry.
Thank you. Sophie?
I feel like someone should do one of those word clouds using AI to see which type of what word comes up the most. And I feel like in a lot of these conversations, the person, you know, the why factor, why are we here? We're here only to look after people who need us. And I want to, it's actually not one of my top three, but it's almost like the ethos of the top three is all of these things are things that function. You know, to use my phone, I need a good internet connection. I need a case because I'm dropping my phone all the time, but that's not the main focus of how I use my phone. I use my phone to connect to people, and we're here because we're to support people. And I feel like that needs to be the main focus. The experience of care for me needs to be on the agenda first and foremost, and then everything emanates from that. How are we supporting care workers to make people's experience of being cared for a positive one? You know, people going to care, it's not like the NHS. You go into the NHS, you break a leg, you want to get out, you want to get home. I've had 3 kids by C-section. I just want to get home, I want to get the baby out, I want to go home. With social care, it's possibly for a lot of people, it's the last place that they're going to take their last breath. It's the last place that they're going to have the best of their mobility. It might be the last place that they might be a place that they find someone that they want to marry and live with for the rest of their lives. If they're an autistic person or person with learning disabilities. And I think the person needs to come first and foremost. And I do miss the we used to talk a lot about Andrea Sutcliffe's The Mum Test. That really helped me. I remember being in my 20s and hearing her talk about that and thinking, yeah, well, that's what it's all about. Would I want my mum to be in a place like that? You know, some people say, would I want to be in a place like that? And I think with commissioners, local authorities, politicians, politics gets in the way of politicians. I mean, we just need to come back to the person. But for my three actually, skills and training, I think someone's mentioned that already. I'm also a governor at a local college, and I've been looking at other colleges and what they train people on. And I think there needs to be some synergy with what we need in this country and what we are training our young people on. Are we giving them enough support within colleges, for example? A lot of people don't want to do A-levels and go to university. We've got an outstanding care home, and the registered manager, who I had to really push to get her to be a registered manager because she didn't think she had the skills, but she's 23. And she's a registered manager of an outstanding residential home. There's a lot of skill in this country that we just need to help and support. And I think that would be one thing I would want to focus on. I also am on the advisory board for the social care workforce race equality standard. And I know Skills for Care has done a lot of work on that. The funding for that is really tricky, and I'd love the government to fund that. I mean, some of the statistics are for minoritized groups working in social care are shocking. 40% are more likely to enter the formal disciplinary process. 20% are more likely to have experienced harassment, bullying, or abuse from service users, people who draw from health and social care. And 30% are more likely as a colleague, and 90% more likely as a manager to have experienced harassment, bullying, or abuse from colleagues and managers. I mean, the experiences of people from the global majority in social care are really shocking. And there's ways we can monitor and support that. And I'd like the government to get onto that, mainly because as a proportion of the population, actually, the social care sector is very diverse. And then lastly, I think, I'm going to bang on about co-production because, I'm director of co-produced care, but I think there just needs to be more co-production. But co-production, not just obviously with the people who are supported at the heart of it, but the whole people who are involved in the system. So people from supported living, residential care, carers, a huge part of it. And so we can have this golden thread that runs along. I think someone talked about, what does one policy impact on everyone else, like with the pay deal, what impact is that going to have? Providers having to raise the pay, which is wonderful, love it, but that is going to have a huge impact on, as a provider, I'm going to have to put up my manager's pay, my coordinator's pay, my administrator's pay, my HR pay, everything is going up, that knock-on effect. And where's the funding coming from for that? Or do I just really need to throw the towel in and give up because I can't pay for it all? So I'd like to hope that those conversations are going on in the background, but I've not heard about them. So those are my top three, although it did feel like a top 10, sorry.
Thank you, Sophie. Very helpful. I'm going to go to Ashley, and then Amanda and Rory, if you stay on with your hands up, but for the next question, if that's all right, because time flies when you have so many interesting views, and it's very interesting to see how you feed into each other. Ashley.
Well, I was going to say some of the stuff that you were talking about, Sophie, just around, if I had a top three, and it's changed so many times just in the last few minutes, listening to everyone's points, but people, and culture is absolutely everything. And talking about why we do what we do. I think sometimes we do forget in all of these very high level discussions that every care worker, every person that works in our sector made a choice to serve others. And of course, we need to be serving our care workers. In terms of priorities, yes, we need to be looking at leadership. We need to be looking at the number one thing is a shared vision, isn't it? And that's been spoken about on this call. To be able to build a culture, you need a vision that is shared by all and understood by all. And then you need a clear, defined set of behaviors to be able to get to where you want to get to. So I would say this focus on people, always thinking about Maslow, a focus on development, pathways, and also Dan, you made a great point about innovation and working in partnership, but whether you're independent sector, public sector, we're all in it together. And I think there is a real, and we've been doing it for years, but almost this renewed focus on taking real ownership as a provider, regardless of which part of the sector that you work in. The government they have just come in. We haven't heard a huge amount about social care yet, but it is going to take time, you know, with this glimmer of hope. And I think we've all got our part to play. So yeah, people and culture, development, and working in partnership with all parts of the sector and each playing our part.
Thank you very much. Very useful. I would like us to move on to the question around registration of the workforce. Interestingly, we've spoken about the regulator that providers have to register with. And registration of care workers is something I've been talking about for as long as I've been involved in social care, which is quite a while now. So first of all, as we have 16 panelists left on the call, just by the show of your actual hand, not the Zoom hand, although it may trigger the Zoom hand, could you raise your hand if you think that social care workers should be registered professionals? There are a lot of caveats, I understand, there are a lot of conditions, etc. But as a general principle, okay. Thank you. I'm getting a lot of hands up. I'm getting some maybe hands. So that's very useful. Thank you. Right. Amanda, I'm not sure if your hand went down because you didn't want to speak on this. So I'll wait for you if you want to put your hand back up. Rory, do you want to go first?
Yeah, I think I'm a nurse, and so I am on a register with the Nursing and Midwifery Council, and I think it's very much in the how. I think it's you know, in principle, it sounds like a fabulous idea. Normally, when I speak to people at healthcare leaders are more in favour of this than carers themselves. And I think, you know, what other minimum wage or close to minimum wage profession would be asked to be on a register like this? And also in terms of the fees, you know, when you talk to nurses about the NMC, even though there are some fabulous people in the NMC, it's normally centres around it's a stick that's used to hit us with, and it's expensive, and we're not paid enough to be able to afford these fees. So there's that. I think in terms of actually professionalising the care workforce or making people see it as a you know, a career ladder, it's about getting more money into carers' pockets. And I think, Carolina, you spoke to the fact that carers now do jobs that nurses wouldn't have done in the past. And I see that all the time. You know, we have carers who are running ventilation machines, where when I was a senior nurse, you know, I wouldn't trust a junior nurse with that. And I think the expectation from commissioners is that for an extra 50 pence, you can manage somebody on a ventilator. And it's kind of it shows a lack of understanding of what carers' jobs are nowadays. And I think as well, when we're talking about that money and getting money into carers' pockets, I always think, you know, we're looking at hospices closing at the moment across the UK, which I think is, you know, that makes, as an ex-hospice nurse, it makes me feel sick, because I can I know that's going to lead to people dying in agony right across the country. And it's I think somebody said before about thinking from that human perspective. How much would you pay to have the person you love most, you know, who's most dearest to you, not die writhing in pain? And I think that's how much carers are worth, not kind of just, you know, seeing it through the lens of economic benefit to the NHS, because that's a very reductive way of seeing the value of care.
Thank you. I'm going to put the hands up aside for a second. And John, as a very large care provider, I'd be very interested to hear from you. What do you think about registration?
I think Rory just nailed it. I think as a principle, I think it's sound. It's the application in practice. So if we're looking to build credibility, professionalize the sector, subject to the things around cost and how it's used, it's sensible. I think it's a sensible thing to do. You know, I think we do it in Scotland. I think we do it in Wales. So yeah, I think it's good practice. But I also worry about it if does it become just a very large bureaucracy or register? For what end? So provided it's done well, I think, and that's why I was sort of hand up, hand not up, was at a principal level, tick. Practically, let's see how it will operate. What good does it bring? What does it build confidence? Does it build competence as well? If it starts to do those things, major supporter.
Thank you very much. And Neil?
Yeah, I think a lot of really good points have been made already. So I'll just try and add to them rather than repeat them. But I think that in principle, yeah, we have to do this, but only in tandem with improvements in wages and terms and conditions. Otherwise, it's like outrageous. I think there are concerns and disadvantages. I've looked at a pathway of nursing associates and how there's resistance from the RCN and others and fears of substitution, and it's a really nuanced debate. But I think that there are many advantages which we're all aware of, but I think just picking up on Sophie's point about inequality, I think one of the benefits of professionalisation is going to mean more consistent access to training, and it may remove inequality, and therefore I hope we'll see even more representation from minority ethnic groups further up the ladder, if you like, into registered manager level. And on registered managers, they need to be registered professionally, because I think there's a lot of snobbery in the NHS that I've witnessed, towards registered managers, and they need to be recognised as well.
Thank you, Neil. It is quite terrifying that registered managers are not registered, but also have to do so many things in their roles, juggling 4 or 5 different roles at the time, and don't get the respect they deserve as well. Richard. You're still on mute, Richard.
How's that? Yeah, I think obviously I'd endorse the comments made before. I think personally I like the idea of this, and I see from a quality and service lots of benefits from an insurance lens viewpoint, but also I can see a lot of the associated challenges. But all I'd say, and I think most people on this call of business will be very aware of this, underwriters look at CQC ratings when they're considering a care risk, whether to offer terms, what terms to offer, and how to rate the cover. And I can see this evolving further from an underwriting view. If they could see or have access to show the overall percentage of the professionalism, and knowing that it would bring a consistent sort of standard of care to a service, and clearly any raising of quality of service provided and increased accountability from an insurer's viewpoint is going to improve risk. A couple of other areas really. I think recognition of value, we've already spoken about making the sector more professional or being seen as more of a profession. I think that would potentially elevate the status of the workforce, and that potentially, and again it's been touched on, needs to enhance status and hopefully better pay and working conditions. And then there's training and development. No doubt CPD would form part of, or a bigger part of the approach to this. And again, that improvement in competence and a confident workforce will feed through from an insurance viewpoint, and again just leads to hopefully better terms, better cover, and more acceptable insurance premiums than perhaps we've got at the moment, really. So yeah, just a couple of things from me, really.
Thank you. Very practical benefits potentially. Thank you. Andrea.
Thanks, Carolina. Yeah, I mean, I feel very strongly about professionalising and I was slightly on the fence about this. What I wouldn't want to see is anybody we could welcome into our sector to be excluded. A lot of our care workers have massive other pressures. Many of them have other care roles, whether it's other family members. They have other pressures on their life in terms of managing work-life balance. I think I would be worried about going down a route of mandating training. What I would want to see is absolutely recognition, absolutely pay and reward, welcoming people from a young age into the sector, having that career pathway, but maybe doing it, we've got to have a flexible workforce. We just have to maintain flexibility. So there'll be huge amounts of opportunity for people to train and specialise in whether it's ABI or mental health or learning disabilities or the Venton track. There's loads of areas that people could build a professional standard. And I think it would give professional accountability. And in many ways, I would support all of it, but I'd be very worried that if it became too rigid and too bureaucratic, it could actually exclude people who may want to learn and professionalize their career over a longer period than somebody else. So I wouldn't want to see anyone feeling that they can't enter this profession because they're not qualified in the way that is mandated. I'd want to avoid that at all costs.
Thank you, Andrea. And I think flexibility is the key if we were to professionalize the workforce in the way of it should be more competency based than a qualification based.
Yeah.
And we should be able to take a variety of evidence to prove that competency. And we definitely don't want to be putting people off it. But I think there is this general lack of sense of belonging in the care workforce beyond potential employer. If the employer is very good. Giving care workers a sense of belonging to a wider profession, giving care workers a professional body that would campaign for them, stand up for them, but also hold them to account for their own standards, and a robust training framework, and pay and reward at a level that you are at within that framework. So it is actually consistent across the country, not so it differs from provider to provider depending on what finance is available. I think would make it much better for care workers, but also in general for people who draw on care as well, because it would make care work seem and be a much more of a career rather than right now come in, come out, come in, come out. And the only option for many people, it seems to be, oh, I have to go into nursing, or I have to go and be a physio and OT, because those are professions and care work is just care work. But it is the sense of belonging that I often get from care workers, that they want to be part of something, but it's very difficult for them to find that.
I completely agree. And I think a registered manager would be a great place to start. I think it's building that flexibility in. If you're a nurse, you tend to work in a particular field. And I think that we need the same within the care sector. We just need to be able to adapt the learning and the opportunity to what people are drawn to wanting to do over a period of time that works for them. That means we don't lose them out of the sector because of additional pressure.
Yeah. Deborah.
Thank you. We've had mixed views about registration at this point in time. It may be the ultimate destination, but our view is we need to think this through very carefully about how it affects people on the ground. We've heard, for example, from people with personal budgets that they are quite worried about having to hire people with certain qualifications because they can't offer those career pathways. Yes, they want qualified workers, but it's not about achieving a qualification. It's about somebody who can support that individual one-on-one in relation to kind of the personal needs. So it doesn't work in all circumstances. I guess the other thought I have is if you look at how other healthcare professions are regulated, it suggests that we really need to focus on the kind of training investment first. A good example might be looking at nursing. When nursing went from general qualifications working in an NHS trust to an academic degree, there was a lot of resistance and a lot of pushback. And so how was that, what did we learn from that transition? We could have something very similar with care workers, and it could become a real disincentive and make it even worse in terms of recruitment and retention if we're requiring a certain level of qualifications and we haven't invested in the development of people. So I guess my view is let's have a clear career pathway. Let's invest in the training and the skills development. Let's stabilize the workforce, and perhaps ultimately we will achieve registration, but that's not the first port of call. It's probably the destination.
Thank you. Sophie.
I love the variety of ideas on this webinar. It's fantastic. So yeah, I mean, I personally have gone back and forth on it, but more recently, and I think influenced by conversations I've had even with you, Carolina, I think it's a no-brainer. I actually think so. Health and social care is the most regulated industry out of all the industries in the UK. It's the most regulated. We also provide a huge amount of training already for our workforce. They are trained, they are competency tested, they are supervised every month, they are mandatory training, they are supplementary training, and then they're being asked to do stuff for the NHS. I don't think training is the problem. I think it's recognition is the problem. And so I think we're ripe and ready for some kind of professionalisation. I get a bit tired of when I talk to care workers, and I think this is maybe part of the lack of engagement with policy, is that sometimes there's a crisis of confidence where people say, I'm just a care worker. I'm just. You're not just. You hold the system up, okay? You make the world go round. And I think we just need to recognise that. And maybe it does start at registered managers. I mean, I've got a real problem with registered managers, actually, with the process with CQC, because we've had a few that just get registered. I had to have a 2-hour in-person interview with CQC to become a registered manager, and at the moment they're just like whizzing people through. So there needs to be some sort of CQC out, obviously, in lots of ways. But you know, they've usually come up the system. They've got a lot of training. They've got a lot of experience. So I actually think we just need to get on with the doing of doing it, and recognise people for what they are worth. The restrictions, absolutely a great point. We don't want to. That's the beauty with social care. It isn't. You can come into social care from any background as long as you really care and you build the skills up from there. We don't want to stop that. It's the beauty of it. I also think there should be you should be able to transfer between specialisms. I've had some great registered managers in a care home who used to work in home care, and somebody who was used to work in supported living, who's really good at dom care. So I think it's transferable skills. I wouldn't want to be too restrictive on it. But I think it is important to recognise people. We've at Co-Produce Care, we're launching a new scheme called Each One Teach One, where we're creating a social care leadership academy that brings together some support and training for people, tools on supervision and all the practical stuff. But also we're making that training CPD accredited, because I want to be able to give to managers and leaders something that they can take with them to any industry, and part of having something that's CPD accredited is helpful, and we just don't provide anything like that for the social care on the regular. So I definitely think there's some work to do on it, and yeah, it was interesting again to hear your views on it as well, Carolina.
Thank you very much, Sophie. What did you say? Did you say see one, teach one, or what was it?
Each one, teach one. So each one, I always think everybody knows what this means. So it's an African proverb, basically, that means each one, teach one. I mean, you'd say it to your children or family members. If you have a skill, you teach somebody else. So it might be an older brother will teach a younger brother or sister or whatever. And I feel within social care, we all have amazing skills and we can teach each other. So what we're going to be doing is getting people together with those skills. And part of the training is going to be learning from sector leaders. And then the other part is going to be talking to each other in a group about what we're doing in our services and how we're supporting people that we look after. So it's kind of teaching, but also kind of mentoring as well, group mentoring.
Thank you. Sounds like a great idea. I'm looking forward to hearing more about it. Richard.
Firstly, this isn't tech, right? So this answer, this comes from more from my own experiences, and so take the ignorance that comes with. But again, there's two strands I want to pull together, which is we're talking a lot about career pathways. So if it's professionalized or not, the one thing I don't think it can do is present a barrier to people getting into care, right? I also believe that some of the best carers have never cared before. From my experience of interviewing and bringing people in, zero experience, absolute shining stars. So however it comes in and whatever it looks like, you've got to be able to enable people to come in. But I do like the career pathway context. My very short CV, not to bore everyone, I started in the kitchens. I loved being with the residents and spending that time. I'm also financially driven, it's worth sharing. I started then working hands-on with the residents, leading the activities programs before commissioning homes. So I took a zigzag path, doing pretty much every job in the home, always seeking like, hey, where's the next, where's the next pay rise? How can I add the most value to the customers, to the staff, before ending up in the office, and then obviously now ultimately in tech. If there was a more structured pathway, that would have been quite handy, right? And there was lots of people that were with me at the same time. That not everyone can randomly jump across places. There aren't those roles for everyone. So this idea of a pathway, And then the last bit to finish on in this unstructured rant of 3 would be like to offer a parallel now on this side of the fence. If a developer that's writing code wants to get, progress in their career, they don't have to become a manager. There's this what we call dual pathways, right? There's always this idea that actually you can stay doing what you're great at, but we can recognize that you are great at this, and therefore you can go on to whether it's earn more or whatever. Again, I'm not saying whether money needs to come from government. It needs to be aligned nationally. That was someone else's point. I agree. But the idea is you can keep being the best carer you are, and because you are great and progressing, we can recognize that while still allowing people to go, actually, yes, now maybe into nursing or into team leader roles and on that way. But it's this idea of offering duality where you don't have to do one thing. You can stay in the industry and you can be great, and we can recognize you for that. I think that's really important.
Thank you very much, Richard. And I think it goes back to what I said about the pathway, those specialism routes for people that have particular interests. I think care workers often tell us, I see on online forums, get frustrated that the training they can access is only the training that their employer says they can or should do, rather than actually following the heart of where they think that would benefit them and people they support. So we've tried on many occasions to access funding for care workers to be able to, or for the fund to be created somewhere else, for care workers to be able to access training directly, so they choose what it is. At the moment, it doesn't really exist that it's funded, and I think it would be great if we could get that, so care workers, give care workers the agency they should have in terms of their own careers, training and development. Amanda.
Hi, thank you. I believe that we should professionalise the role of the carer. Don't we have a whole bunch of professionals anyway, in terms of everything that they're doing every day for our residents and for our homes? So let's acknowledge that. I think listening to the points that everybody's made has helped me reflect on our upcoming staff survey, team member survey. Let's ask the care worker. Let's include that in our surveys of people and ask them what they think. I think the caveat to that is contextualizing what we're asking them, so make sure we're understanding, or they're understanding, what that means, because I can see from the points that people have made that could send our care teams into a spiral of, I'm going to be asked to do more for less, it's going to take more of my time to be given freely outside of work. So it needs to be asked in such a way that shows them the end result, that you're recognised as a professional body of people, supported by your provider, supported by lobbyists, supported by charities who also support lobbying, and most importantly, supported by the government, and therefore supported by funding. So imagine that all that support is there. Would you like to be considered and named and registered as a professional care worker? I'm so curious to see what the answer is going to be, and it's going to take some design, but let's ask the workforce.
Yeah, that absolutely is our attention, one of the parts of the project for the advisory board for care workers and a wider survey. But you're absolutely right, it is crucial how you contextualize the question. It's very difficult to ask that question without knowing if the government is interested, and if it is, in what format it would happen. Because I think, so I've asked in a survey that question to care workers in the past. We'll be asking it again this year when we're doing our wellbeing survey of care workers, and care workers do consider themselves professionals. Then as you step down and ask the wider circles, do your family and friends consider you a professional? The number drops down. And then you ask the wider, do you think the wider society asks you? So many hands come down, so many fewer people think that is the case. But it really is, would it just be a register to punish care workers when they do something wrong, to strike them off a register? Because that's not something that I think would be useful in any shape or form. Or is it this whole infrastructure, when you recognize them, when you reward them, when you give them training and development opportunities, and where there is a place, a professional body that when they get abused at work, and care workers get abused at work a lot by very different groups of people, they can actually go and say, this is happening. And something is being done about it. And we actually have a record of it, because it's impossible to find numbers for that right now. So yes, I absolutely agree. It very much depends on who and how is asking that question. And on the well-being survey, I really do hope, because there was a massive well-being survey done with care workers last year by DHSC, Skills for Care and Ipsos. And those results are sitting with the Department of Health and Social Care. And I'm absolutely desperate for them to publish that. I don't think we'll be surprised by a lot of it or any of it. But I think it's important to have those details out in the public domain. We are still going to do our own as well, because we want an annual data on well-being, temperature check on well-being of care workers, and see where they are. Dan.
Okay, well, once again, I think it points towards the fact that we need a sort of we need to be driving this. I think we're passively responding to potential, ideas coming from places where we are the sector, and I think we ought to be really sort of leading on that discussion and that debate, and that once again comes to that issue around merged associations. But I was also left thinking about we have registers for care workers in Wales, and I think Scotland as well. Is there any sort of reflection on what goes on there? Because I'm not particularly familiar with it, and how that's changed and impacted how care is delivered. What's the quality of care? Has that changed anything? And has it changed anything relating to the perception of care in that part of the world? Has it helped attract people to care? Has it helped retain people in it? I suspect the answers are pretty lukewarm. But I think, so really to summarize, I think we should try to collectively drive this debate, and maybe a survey like you're suggesting may be part of that narrative. And secondly, I think we ought to do it from a research perspective as well. So not just the UK, but is there any other parts of the world where these steps have been taken, and to see whether we can actually design something proactively that actually we think will actually take us somewhere forward and won't just be an administrative burden, and the second part of that, and potential cost burden on an industry that at times is strapped for cash. Because if it's going to be done properly, Carolina, taking your point, there needs to have some authority about it. And if that's the case, we would want to be chipping in, paying a subscription fee and things like that. But it's for that to be seen to be a benefit, we really want to design it from the outset to have something that's meaningful and makes a difference to what we do and the people that work to deliver the care that we do.
Thank you, and I absolutely agree. And there is international evidence in very different shapes and forms of what's been done, how it's been done. I think the advantage of doing it after some other countries have done it, including developed nations, is that you can learn from mistakes. There's a lot of learning to be done, which in itself gives you a good starting point of making something better that really works. So thank you. Right, I have Claire, Bhavna, and Rebecca. We have 3 minutes left, so you have 50 seconds each, so then I can close as well.
Do you want me to go? No pressure then, Carolina. So just on professionalism, I waver. In principle, I agree with it. As a lawyer, you would think I would agree with it, but what I don't want is top-down regulation that doesn't actually benefit anyone and just adds to the complexity and the bureaucracy in what is already one of the most regulated sectors in the country. So I think it has to be led by the sector. I think it has to be led by the workforce. We need a clear career pathway. We need the recognition, but we don't necessarily need all the bureaucracy that can come with that. Although it might do me some good with fees, that wouldn't really be what I want. So I think we have to be careful what we ask for, and we need that united voice in how we ask for it that needs to be across the sector.
Thank you, Claire. And yeah, additional bureaucracy is definitely a worry, and a professional body for care workers that registered should be led by care workers. I can't see somebody in the leadership team there who's never done a care job. If that happens, then that's the
but
wrong
we
way.
see it so often with some of the other bodies that are put in place.
Thank you. Bhavna, your 50 seconds.
My view is it could be a force for good. We see often care staff being treated quite poorly. Having an organised professional body set up behind it, Care Workers Charity being something similar. The administrative costs have always been the issue that when I've discussed this in Westminster, they've said it would cost too much, whatever. But if done correctly, it could be force for good. It would recognise the care workers in a much more professional element. And I think it would work for raising the profile of the care sector. So for me, it's a win-win if done properly. Otherwise, it's going to be a recipe for disaster.
Thank you, Bhavna. And Rebecca.
Yeah, I mean, I'm sort of in favour in principle, having operated in Wales, where the adult social care workforce already register. I think some of the things that we saw as a benefit, and I think that our care staff saw as a benefit, was around that professional recognition and that sense of pride in their role. I think the code of conduct was good. It clarified, what it was about, what being a carer was about. And I think that a lot of our staff were proud of their status. I'd also say it also helps to hold providers accountable in terms of CPD requirements. And I think that's really important that providers are investing into their workforce and supporting people to develop better skills, whether that's going up the ladder or whether that's going into a more specialist area or just becoming more highly skilled in their role as a care assistant or a support worker. But would agree with others that certainly we don't want to put any more barriers in anyone's way, and that it would have to be carefully administrated.
Thank you very much. Very helpful. That brings us to the end of our 2 hours, which I don't know about you, but to me it's gone very, very fast. And we could, I'm sure, talk for another 2 days. Not sure anybody would listen to us talking for 2 days. Thank you very much to all of you for your contributions today. Thank you to everybody listening. Like I mentioned before, this has been recorded. We are going to be sending it around, especially to our new care minister, Kinnock, who to me seems like he wants to listen and he wants to learn. And I think this is a great conversation, hopefully for him to listen to as well. Thank you again. As it's a webinar, as we finish it, it will just cut off. So yes, have a lovely afternoon. Thank you again, and happy Professional Care Workers Week. Thank you. Bye-bye.
Bye-bye.
Bye.